Hello, good evening. My name is Isa Korede. Okay, I have my name here. Today's date is June 6, 2023. So I'm going to do a quick presentation on using my on surface anatomy, and I'm going to use myself as a human model. Okay, so I number one, I'm going to mention five different external structures of the body. Okay, that applies to surface anatomy. Very significant part. Okay. Number one, I'm going to mention the sternocleidomastoid. The sternocleidomastoid. It's a very prominent muscle here, okay, that connects, starting from the mastoid process down to the clavicle and the sternum. Okay, that's number one. Number two, I'm going to mention the typical and of course the mastoid prominence just behind the ear. Okay, it's just behind the ear, mastoid prominence. Okay, yeah, it's very it's a huge is a an important attachment site for most muscles. Okay, I'm going to mention the thyroid cartilage, the Adam's apple thyroid cartilage. Okay, very prominent in men. Okay, also I'm going to mention the cricoid cartilage, Okay, okay, in between the thyroid cartilage and the cricoid cartilage is a cricothyroid membrane. Okay, the cricothyroid membrane is like a hole in between the thyroid and the cricoid cartilage. Okay, also I'm going to mention important, okay, peripheral IV sites for very significant, very important, very popular among health workers. Okay, it's a median cubital vein, or they call it antecubital vein. Okay, the median cubital vein. Okay, if I try to contract my, I'll probably get to it's one the vein here. Okay, very popular, prominent vein here. Okay, I can feel it here. Okay, I can palpate it here. Okay, it joins it's a connecting it connects the cephalic and the basilic vein. Okay, okay. Also, well, I think that completes five. Okay, okay. I'm gonna mention what system these sites represent. Okay, of course, the sternocleidomastoid represent the skeletal muscle, the mastoid process cranial skeletal system. The Adams and the cricoid cartilages, they represent the lower respiratory system. Okay, and of course the cricothyroid membrane that I mentioned earlier, that I can palpate from here, it's also lower respiratory system. And of course, the median cubital vein I mentioned represent one of the vascular cardiovascular system. Okay, the vein. It's a vein. So I'm going to mention, what are the importance of surface anatomy. So surface anatomy has helped me a lot in since I began this class. Okay, in trying to uh, 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 trying to palpate and externally feel different structures of the body. Okay, it has really helped me a lot. Okay, and it has also improved my and knowing how to palpate also obviously improves my physical examination skills. Okay, I can actually palpate and examine the human body better. Okay, since I started this class, so that's one importance. Okay, also the last question mention the clinical significance of two of these five structures I mentioned earlier. Okay, one importance. Okay, I'm going to apply the cricothyroid membrane. Okay, I'm gonna tell you the significance, medical significance. Okay, it's a temporary pathway. Okay, during emergencies, if there's an upper way obstruction, okay, the cricothyroid membrane, it's a temporary. You can puncture the cricothyroid membrane. Okay, and creates a temporary headway. Okay, during emergency period. Okay, if a patient is in emergency and there's an upper airway obstruction, okay, you can get actually access and airway through the cricothyroid membrane. Okay, and of course, okay, also I can feel the trachea. The trachea is also, I can feel the trachea from here. Okay, the trachea is I mean, it's also very, okay. Most surgeon usually incise the trachea too. Okay, just to get an temporary access. Okay, okay. Also, the median cubital vein during emergency period. Okay, it's a very popular site accessed by emergency nurses or phlebotomists. Okay, they just want to get access to a peripheral IV. Probably they want to get a blood sample, or they want to get a quick access to transfuse IV infusion or blood products. Okay, the median cubital vein is an access. It's a very good access. Okay, very good access to get access to during the emergency period. Okay, I hope I made sense. Thank you very much. Thank you.